Welcome to Jothydev Diabetes Gems video edition. In this issue, the presentation by Dr. Jothydev is on the extra benefit of insulin pump other than blood sugar lowering. Now over to the presentation. Thank you.
Absolutely. Insulin pumps, when used in type 2 diabetes, have got added advantages. We have been using insulin pumps in type 2 diabetes since early 2005. And in this YouTube video presentation, we will be providing some important links to some of our original research presentations and publications globally. We do have insulin pump patients from different parts of the world, like from within India, from Dubai, from Doha, from Muscat, from Germany, from Ethiopia, from the United States, from Malaysia, etc., etc. Insulin pumps are not to be considered as a new medicine. Insulin pumps offer a different methodology for delivering insulin. We have insulin pens and syringes for delivering insulin, whereas in insulin pumps, the delivery of insulin is quite different. It is not like injections. It is continuous subcutaneous insulin infusion, which makes all the changes for the patient, for the doctor, and for researchers like us in the outcomes. When insulin is given as an injection, it is given once daily or 2 times a day or 3 times a day. Whereas when the same insulin is filled into the pump, the infusion is continuous and the patient is also capable of taking the bolus dosages, not just 2 or 3 times daily. It can be up to 6 or 8 or even more, depending upon the requirement of the patient. Now let us see how it works. There are a variety of pump manufacturers in the world. Some of the commonly used pumps are the Medtronic insulin pumps, then the real-time pumps from Medtronic, the Accu-Chek Spirit, the Accu-Chek Combo, and you have the Animas pumps. But whatever be the pump, the mechanism is the same, the principle is the same. There is a infusion set. The infusion set will go subcutaneously under the skin. The other end of the infusion set, you have a reservoir which is filled with a fast-acting or a rapid-acting insulin like aspart. And the insulin which is kept inside the pump like this will be gradually subcutaneously delivered, and that will take care of both the basal and the bolus requirements. Why insulin pump? Of course, when you are having convenient and cheaper methods of delivering insulin, like using an insulin syringe or an insulin pen, why should we go for insulin pumps? The simple reason is flexibility in lifestyles, tremendous improvement in the quality of life, convenience for frequent travelers, those who will delay their food because of business, those who would like to have more calories, or those who would like to change the pattern in which insulin is delivered. Insulin pumps will offer different basal rates. Unlike Lantus or Levemir or Degludec, you can change the basal infusion profiles up to 48 profiles per day. And on an average, in type 2 diabetes, in our clinical scenario, we use up to 4 to 5 profiles per patient. And if you look at our original research and from others around the globe, insulin pumps, when used in type 2 diabetes, not only just control the blood glucose or A1C level or the so-called glycemic excursions, it is a fantastic tool for the reversal of neuropathic pain, And the studies have initially shown a dramatic improvement in the sexual function in both men and women. And in those men with erectile dysfunction, somehow insulin pumps, when used from 3 months to 6 months, there is a tremendous improvement in the sexual function. The terminology insulin pump is unsuitable for a simple delivery device for subcutaneous continuous insulin delivery. However, this is a tiny sophisticated computer which has got a multitude of functions and is best suited for a techno-savvy patient. And our published data throws light into the evidence that insulin pumps should never be prescribed for somebody who will use it for luxury and not for life. And that is highlighted in one of the articles in this week's JDC Diabetes Gems. Insulin pumps should only be used in those individuals with type 1 and type 2 diabetes who will learn it properly, use it properly, and will utilize it for life and not for luxury. See you next month. Until then, goodbye.